This is Monique with Your Daily Sunshine. I was thinking about my mom the other day and I said, I need to tell them about UTIs and pressure points. My mom had multiple sclerosis and she also had a couple of strokes, which ultimately landed her in the hospital for long term skilled care. Those are, some terminology they'll throw at you. Skilled care because she needed a nurse. She couldn't do anything for herself her last few years. The stroke and with her multiple sclerosis, the MS had um, really limited her function, and so she needed someone to help her do everything. What I want to relate to you is if you have a bedridden loved one that you're taking care of or you oversee care for, two things to look out for. My mom was always in the hospital for UTIs, and that's urinary tract infections. The second one is to make sure that they're properly being turned. They need to be turned every 2 hours to make sure that they don't have pressure points or ulcers or bed sores. And that's where the body or the tissue breaks down after, your weight. And by them not moving, by us normally, we're able to move. We don't sit in a position too long. But by them not able to move themselves, that dead weight will just lay back. And the more they lay back on a certain position, a sore can occur. If you don't get it in time, it'll start really opening up. And just like my dad with the ulcer on his toe, you can see the bone. My mom, she had a similar situation. Also, hers was like 100 times worse. Hers was almost like the size of my fist, and it was on her lower buttock. And we didn't catch it in time. We tried to stay on top of it, and ultimately, she needed surgery. So after that, we made sure to make sure she was turned, and eventually we had her placed on a special mattress, one of those air mattresses. Even though you may have an air mattress or you may have one of those soft mattresses, you still have to make sure your loved one is turned. Turn on the side, turn to the back, turn to the side, and then make sure you're looking at the bottom of their feet, because the bottom of their feet also needs to be up, because we would place the pillow in between her legs, and then we will also place something underneath both of her heels, because by that weight being there. And if she sat up in a chair, we would have pillows underneath her legs and feet. And then also for the back of her head, we had like one of those pillows, just so if she went back, the back of her head wouldn't have like that pressure point right there. It's a lot, but you just start small, you just keep looking, and for us, we just had to figure it out. We had a special cushion placed into her chair, so when she sat up, the pressure point on her, I want to say her butt, didn't take too much weight. And then also we made sure that she didn't stay up too long, because also with staying up long, you would get another pressure point, and that's the way she had the first one. So then with urinary tract infections, she was on a feeding tube because she didn't, of course, eat through her mouth. She ate through the feeding tube. I'm not sure if the feeding tube had anything to do with not getting enough fluids because they had to put it through and everything else, but it's just a lot. You have to look at and look through and think for your loved one if they aren't able to communicate to you and let you know. You might be able to see with their facial expression if they're in pain, but you just have to think for them to see if you were sitting there or if you were laying there, would you be comfortable? Just some tips to look out for UTIs, which is urinary tract infections, and pressure points, which are bed sores and ulcers. This is Monique. Have a great day.